Hi, this is Dr. Pam Williams again, back for Vital Signs Part 2. I think I was cut off on this slide. I wasn't keeping track of my time. So yes, infants are, their pulse is taken with an apical rate with a stethoscope. You're not going to use their hand or their wrist or anything like that, even though in CPR we use the brachial. But at any rate, just for taking their vital signs, we use the apical rate with the stethoscope. It says in children older than 2 to use the radial site. I think it's still easier to listen to a heart on a child who's 2 because their arms are kind of waving all the time anyway. And then count for that full minute, especially with movement. Look for respirations again, and look at their bellies, and just ask them not to talk, or give them something to look at or a book so that you can really look at their respirations and not with them talking. Blood pressure, the same as with adults. We're going to be using a cuff that fits them, and there are different pediatric sized cuffs to use as well as a pediatric sized stethoscope. Again, using a bell or a diaphragm, whatever you can hear the sound the best with. Crying infants are going to always be raising their vitals. So if you can get them to quiet with a pacifier, with their parent holding them, that's always going to be a best. Listen for the disappearance of the sound because you might not get any muffling with an infant or a child. And again, this height more strongly correlated to blood pressure than age. So if you have a tall 5-year-old who's more the height of a 7-year-old, that's what we're going to use as to see if it's appropriate for their size rather than perhaps their age. The aging adult, the temperature may not be as likely to rise with a fever. So they may be having an increase, but their temperature is still showing 99.2. When they were younger, they perhaps would have had a 100 or 102 fever, but as they get older, they're not going to have an increase, although when they're really, really sick and definitely do have an infection, their temperature will rise. Pulse, with this normal rate of 60 to 100, the rhythm might be slightly irregular. We're just going to document that. We're not going to say that they have a disease. We're only documenting. We describe what's going on. We don't necessarily diagnose. It says that the pulse may be easier to feel in an older person. Possibly that's so. And just because they have abnormal signs, again, does not indicate a disease. So respiration. So an older person can't hold as much air in their lungs, so they may be breathing faster, and their respirations may be a bit shallower. That's just what normally can happen. Blood pressure may rise with an older person, almost anticipate it, that they may look again like they're prehypertensive or hypertensive 1 without a real disease pathology going on. We're just taking the blood pressure, we're not diagnosing with it. A pulse oximeter is it's about 30 years old now that we've been using a pulse oximeter to find out what their oxygen levels are in their blood. Up until the invention of this cute little machine, we had to do arterial blood gases, abbreviated as ABGs. So this is very simple, very non-invasive, incredibly easy to use. It's this paperclip type thing that's put on the person's finger with the cord generally along the top of the finger, not along their palm. Light is given off on one end of it. It's how much is absorbed is picked up on the other side. If they have a lot of hemoglobin, not much is absorbed. If they don't have a lot of hemoglobin, a lot is absorbed, and that's going to be an inverse relation to how much hemoglobin they have. Don't worry, the machine is going to give you a number. So this says that a 97, 98 is a normal. Some places, some books will say 95 and higher is going to be normal. I liked my patients to have a 97. You're going to have the patient not talking, not moving, and seeing, and you can usually get 100% oxygenation. Try this on your own fingers whenever you're in the lab, whenever you're sitting not talking, or whenever you're talking and moving around, and see what that does to your pulse ox number. An earlobe can be used, especially, like this says, affected with peripheral vasoconstriction or an injury or a cold hand. It can make a big difference as to what kind of number we get. Doppler is a really cool machine. It uses sound waves to depict blood flowing through an artery. Blood flowing, or It's usually an artery, so we're going to be hearing this pulsing. If the blood isn't flowing, we're not going to be hearing it. We can use this with pulses. We can use this with blood pressures. If we're using it for a blood pressure, whenever we put the cuff on and that blood starts to flow, we're going to hear that systolic, that first carot cough sound. However, it's always going to be picking up blood flowing, so we're not going to get a diastolic. No matter how low that number is, it's always going to be flowing. So we're only going to say the systolic number derived through Doppler, and we can't give a lower number. Be careful how you put that blood pressure cuff on. It should not be able to be moved. We are going to use, yes, this coupling gel. It needs that to transmit the sound into the person. We could use water or alcohol, but that evaporates so fast. So this gel is nice. We're not going to push too hard with a Doppler instrument because it could stop the blood flow. So we're going to listen to it. It does have to be perpendicular to that artery, so sometimes you may have to angle it a little bit in order to get the best sound. So I just encourage that you play with it. Don't drop it. They're expensive, and they can be broken when they're dropped. So play with it. It's really good for finding those arteries that are hard to find, like a popliteal, which we'll get into when we talk about peripheral vascular. But play with it. Culture and genetics. Please know that we're not all the same, and that our genetic makeup has a big impact on how healthy we are, on how our health is expressed. So too can environment. Whether a person's skin is going to be toughened through exposure to sun, whether they're going to have differences, just genetic makeup. Again, we already talked about an African American. Other signs, vital signs, like well, height isn't really a vital sign, but different cultures are going to have different heights that's expected or normal of them. So don't classify one person on a broad range that is going to be too strict. When you see here this NHANES data being that 36% of adults are obese, that's more than 1 out of 3. That's a high number of obesity. We are not a very healthy nation. So we have to know how to assess a person who's obese and interview a person. This should be our last slide. Sorry about that. So again, I apologize for this going into 2 kind of abruptly, but we may have lectures that are recorded if a snow day occurs, or like before, I didn't get through one of the slides, and it's a nice way to have a lecture. If you have any questions, email me or talk about this in class. Thank you very much. See you in class.